This weekend, there is an event taking place that'll help you improve your health and your family's health. This is the Community Health and Wellness Fair. It's being held at Curry Park Sunday.
And it's organized by the Metro Youth Diversion Center in partnership with healthcare advocates from across the state, including Children's Minnesota. So the goal here to provide care and increase the community's health literacy. So we this morning talking about this with us, Dr. Miriam Roby from Children's. Thanks so much, Doctor, for being here with us today.
Thank you so much.
So we talked about health literacy, improving health literacy. Can you help us explain what that means?
That means that we would like to help promote any sort of health understanding about the care that the patients, their community, the family, and in coordination with helping them to understand how to advocate for themselves. Health literacy in itself makes that the individuals will promote health care and understanding of any of the issues that may arise. And if that is not something that, especially in English, that is not less proficient in the community, we want to help partner with that.
So this is more than just, let's say, knowing your blood pressure.
Right.
This is knowing where to go, knowing when to go
Correct.
and seek treatment.
Correct. In regards to asthma care, pain secondary to sickle cell, mental health, all that's really prevalent in our communities.
So this event specifically, because you just mentioned this, specifically this will help them and give them the tools, it sounds like. That way they are ready to take care of themselves in these situations.
Correct. And so with this event, what we will go to the community and we will provide health literacy education in a fun way. We will have information that will provide them understanding about how to take care of asthma in an urban setting, how to take care of their mental health, when to seek care in anchor institutions such as Children's, how we can help promote access to them, in addition to making sure that we're being culturally sensitive at the same time.
You mentioned culturally sensitive. I mean, you think about, Minnesota is so diverse, and we've seen that, whether it be Somali population, our Asian population, our American Indian population too. Language, as you mentioned before, that can really be a barrier here.
Yes.
And I'm guessing you've seen that with your work.
We have, and where Children's Minnesota has really taken a stance is to make sure that we stand firm on wanting to provide culturally sensitive care. If that means having our equity and inclusion department round, such as individuals such as myself. We also have health equity coaches that are well diverse in trying to proactively have some of that information displayed. We have translating services. Even at the event, we will have different individuals who will help partner with some of the translative services to help promote some of that education.
So you are with Children's, but this is for more than just kids, right?
Yes. This event is not just for children. We want for the entire community to show. We have different organizations that are partnering, but Children's is the largest pediatric population. So of course we'll be geared towards our pediatric and making it in a fun way.
I was going to say, so then what do you have scheduled for kids? I mean, you mentioned kids. It's not necessarily just for kids, but kids are going to be a big draw for it, though.
Kids will be a big draw. We'll have our two mascots, Twinkle and Sparkle. We'll help entertain them. We'll have henna, we'll have music, we'll have a very fun environment. We'll have the education, videos, we'll have little mock asthma inhalers that have no medication in there, but we'll teach them on how to do that. Bike helmet safety, which is so important and it's timely with the memorial, and as far as our trauma team will also help burn care and drowning.
I wonder, is this the key to improving health literacy of the hospitals, of the healthcare institutions getting out into the community, going to the people where they are?
100%. The key is for us to meet the community where they are. We serve the community, not the other way around. And again, I really want to emphasize Children's being an anchor hospital in not only St. Paul, but Minneapolis. That is the community that we serve. We are the community. And so therefore it is very imperative that not only do we see the individuals in our building, but outside as well within the community to promote.
Miriam, this is great, a great event. Thank you so much for taking a couple minutes to join us this morning to talk about it.
Yes, thank you so much.